Have you ever wondered if the daily vitamins you take might be a double-edged sword? Good for your heart, but silently damaging your brain's blood vessels. Today, I want to share with you some rarely spoken truths about vitamins as after age 60. Supplements may be meant to protect your health, but when combined incorrectly, they can lead to strokes, liver damage, or nerve issues, all without you even realizing it. Could you be overdosing without knowing? You take vitamin D and calcium every morning, but could you unknowingly be sending that calcium into your arteries instead of your bones? The answer lies in a seemingly simple habit: hydration and movement. 1. Vitamin B6, a brain booster that strikes the nerves. Many older adults take vitamin B6 hoping to improve memory, not knowing that high doses over 100 milligrams per day can cause peripheral nerve damage, leading to tingling, loss of balance, and sometimes irreversible damage. It's especially risky when combined with over-the-counter nerve support supplements. I remember Mr. Harold Jenkins, 76-year-old retired truck driver. He walked into my clinic with an unsteady gait and said his feet felt like they were standing in sand. "I guess I'm just getting old, Doc," he chuckled. But I saw the worry in his eyes. He described numbness starting in his toes, spreading to his hands. Sometimes his hands trembled holding a cup. His family thought it was just aging or maybe early diabetes, but his blood sugar was normal. The problem wasn't age or disease, it was sitting on his kitchen shelf. He showed me a memory booster supplement he'd bought online. The label proudly claimed supports brain and circulation, but each pill contained 100 milligrams of B6, and he'd been taking 2 a day for over a year. That's 200 milligrams daily, 10 times the recommended upper limit for seniors. Vitamin B6 is water-soluble, but that doesn't mean it flushes out quickly. At high doses over time, it accumulates and starts damaging the protective sheath around nerves, like stripping insulation off wires. Without that sheath, signals get scrambled. Result: tingling, weakness, tremors, loss of balance, and, if caught too late, permanent nerve injury. Mr. Jenkins was lucky. We stopped the supplement in time, and after months of therapy he could walk with a cane, but he never drove again. "I just wanted to stay sharp," he told me. "I didn't know I was harming my own nerves." B6 is vital, but seniors only need about 2 to 10 milligrams daily, including food sources. Yet many brain, memory, or nerve pills have 50, 100, even 200 milligrams with no clear warning. What worries me most? B6 damage is sneaky. One day it's mild tingling, the next it's dizziness. Eventually you can't tell if it's aging or an everyday mistake sabotaging your health. So if you're taking any supplement labeled brain or memory, flip the bottle over. If you see B6, check the dose. Remember, protecting your mind doesn't begin with a pill, it begins with understanding what you put in your body each day. 2. Vitamin D, the invisible stroke risk in your sleep. Many patients take high doses of vitamin D, 5,000 to 10,000 IU at night, to absorb better. But for those over 60, excess calcium in the blood during sleep can harden arteries, raise blood pressure, and increase stroke risk with no warning signs. One of my patients, Mr. Walter, 72, was healthy, no major conditions, but one night, he had a minor stroke in his sleep. His family was stunned. He ate well and walked every day. Then I reviewed his supplements. He'd been taking 10,000 IU of vitamin D every night for over 6 months. People think nighttime dosing improves absorption, but in older adults, large nighttime doses can spike calcium levels, stiffen arteries, and raise blood pressure, all quietly while you sleep. This silent pressure can trigger a stroke before morning. Vitamin D is essential, but it must be taken in the right dose, at the right time, ideally with blood testing to guide you. More is not always better. especially after 60.3 energy drinks or B-complex supplements that backfire. Many older adults drink caffeine-free energy drinks or take B-complex supplements to stay alert, but they often contain high doses of niacin and B6, which can cause facial flushing, blood pressure swings, and over time, mild strokes or nerve issues. I recall a patient named Linda, 68, very disciplined with her health. She avoided coffee to sleep better, but drank a caffeine-free energy drink every morning to stay sharp. It's all B vitamins. Doc, great for the brain, she told me. I nodded, then checked the label. Each bottle had over 40 milligrams of B6, the recommended daily intake for older adults, and she drank one every day. B vitamins, especially B6 and niacin, are marketed as energy boosters, but high doses over time can cause flushing, dizziness, blood pressure fluctuations, and more seriously peripheral nerve damage. That's tingling limbs, poor balance, and even silent mini-strokes. After a few months, Linda reported numb fingers and poor sleep. Once she stopped the drink, her symptoms began to ease. My advice: don't let supplement labels fool you. After 60, your body processes excess vitamins more slowly. Choose only what you need, and avoid relying on a bottle for energy. 4. Vitamin A. I support that pressures the brain. Vitamin A doesn't flush out in urine. It builds up in the liver and brain over time. This can raise intracranial pressure, causing headaches, blurry vision, dizziness, and is often mistaken for a stroke. Especially dangerous for those taking multiple eye health or anti-aging pills. One of my patients, a 68-year-old woman, came in with headaches, dizziness, and blurred vision. She feared a mini stroke, but after testing, the cause was her daily supplements used for 2 years. Vitamin A, unlike water-soluble vitamins, is fat-soluble and accumulates if overused. Seniors are at higher risk, especially when using several supplements at once labeled for vision, anti-aging, or beauty that often contain vitamin A or beta-carotene. This isn't just a vitamin overdose. Chronic buildup raises pressure inside the skull. Patients may feel dull headaches, nausea, reduced vision, or trouble walking, often misdiagnosed as a stroke. My point is, eye support doesn't mean more vitamin A is better. Seniors don't need high doses. A balanced diet with orange vegetables, eggs, liver, and dairy is usually enough. If you're using multiple supplements for vision or skin, check for vitamin A on the label, and most importantly, talk to your doctor. Sometimes, our good intentions can become a silent burden on the brain. 5. Self-supplementing with vitamin E while on heart medications. High doses of vitamin E over 400 IU per day act as a blood thinner. When combined with medications like aspirin, warfarin, or Plavix, it can overthin the blood, increasing the risk of brain hemorrhage. Even a light bump may cause a blood vessel in the brain to rupture. I remember one patient, Mrs. Doherty, 72, who lived alone in rural Nebraska, a thoughtful, meticulous woman who cared deeply about her health. She monitored her blood pressure regularly and took aspirin daily as prescribed to prevent stroke. One afternoon, she was rushed to the ER with a severe headache after bumping her head lightly on a kitchen cabinet. A CT scan revealed a small brain bleed, not from blunt trauma, but from overly thin blood. I asked, "Are you taking anything besides your heart medication?" She nodded. "Yes, I've been taking high-dose vitamin E. I heard it's good for the heart." That was the issue. High-dose vitamin E, especially over 400 IU day, has anticoagulant properties. On its own, it might not cause a problem, but when combined with other blood thinners like aspirin, warfarin, or Plavix, it significantly increases the bleeding risk. In older adults, even a slight knock can trigger an unexpected stroke. I'm not against vitamin E, but we need to understand what our bodies truly need and what we're already taking. A seemingly harmless supplement can be the last drop that overflows the cup. If you're on heart medication, don't take vitamin E supplements without consulting your doctor. That simple step could be the difference between a peaceful afternoon and a life-threatening stroke. If this video was helpful, feel free to like and subscribe to support our work. 6. Niacin, vitamin B3, good for the heart, harmful for the brain. High doses of niacin 500 to 2000 milligrams per day cause intense vasodilation, followed by rapid vasoconstriction resulting in abrupt blood pressure fluctuations. In older adults with fragile blood vessels, this can trigger transient ischemic attacks or worsen existing cardiovascular conditions. Many seniors are advised to take niacin vitamin B together to improve cholesterol levels that lower LDL and raises HDL. However, what few people emphasize is that at high doses, niacin becomes a double-edged sword, particularly dangerous for the delicate cerebral vessels common after age 60. Therapeutic doses of niacin range from 500 to 2000 milligrams daily, dozens of times higher than the body's normal requirement. At that level, niacin causes intense flushing, face and chest redness, followed by sudden vasoconstriction leading to unstable blood pressure swings in just minutes. These changes strain small vessels, especially those in the brain. One patient, Mr. Carl, 72, was very careful with his diet and medications. After reading online that niacin was good for the heart, he bought high-dose niacin supplements and started taking them daily. One morning he woke up flushed, with a racing heart, then suddenly felt dizzy and lost balance. He was diagnosed with a TIA. Thankfully, there was no permanent damage, but his cardiologist immediately stopped the niacin. Niacin can worsen underlying conditions like hypertension, heart failure, or coronary artery disease, especially when taken without medical supervision. Key takeaway: if you're considering niacin for heart health, always consult your doctor first. No vitamin is completely harmless, especially at therapeutic doses. For older adults, what matters most is not just having the right supplement, but the right fit for your unique body. 7. Mixing multiple multivitamins without tracking total dosages. Some people take a multivitamin in the morning, an eye health supplement at noon, and a bone support pill in the evening, unaware that all of them may contain the same fat-soluble vitamins, A, D, and E. This can lead to dangerous accumulation. I had a patient, Mrs. Margaret, 72, very attentive to her health. She started her day with a multivitamin. At lunch she added a supplement for macular degeneration. In the evening, one for bone health due to family history of osteoporosis. 3 pills, 3 purposes, but what she didn't realize was that each one included vitamins A, D, and EUC. More is not always better. Vitamins A, D, and E are fat-soluble. Unlike B or C vitamins, they aren't flushed out in urine. Instead, they accumulate in the liver, nervous system, and brain silently and gradually. Over time, this buildup can lead to increased intracranial pressure, headaches, vision changes, liver damage, or unexplained neurological symptoms. I sat down with Mrs. Margaret, reviewed each label, and added up the small doses she thought were negligible. The total was dangerously high. Being health conscious is admirable, but without proper knowledge it can backfire. If you're taking multiple supplements, take a few minutes to check the ingredients, especially for fat-soluble vitamins. Your body remembers what you might not notice. 8. Taking vitamin D and calcium. Without enough water or movement, when you take calcium and vitamin D but don't hydrate or move, calcium may not reach the bones. Instead, it deposits in blood vessels. For those with pre-existing atherosclerosis, this increases the risk of stroke or heart attack, especially in the morning when blood is more concentrated. One of my former patients, Mrs. Margaret, 72, was very diligent about her supplements. Every morning, She took her vitamin D and calcium after breakfast like clockwork, but she overlooked one thing. The body can't do the work for us. She barely exercised, mostly staying indoors or tending her garden, and she didn't drink much water, fearing nighttime trips to the bathroom. One day she was hospitalized with chest pain, and imaging showed calcium deposits in her arteries. You see, calcium and vitamin D are essential for bone health, but they don't automatically go into the bones. Without enough water, blood thickens. Without movement, circulation slows. That's when calcium gets stuck and begins to build up in blood vessel walls, particularly where damage already exists. This can lead to stroke or heart attack, especially in the early morning. When blood is naturally thicker, my advice is simple. If you're taking calcium and vitamin D, drink at least 1 to 2 glasses of water with each dose, and try to stay lightly active daily. A walk around the house, some stretches, or simply standing and moving every 30 to 60 minutes helps the body use minerals properly and keeps your heart safe. Vitamins are only part of the solution. Movement and hydration are the rest. Conclusion: at our age, staying healthy isn't about chasing the newest trends. It's about knowing what's enough, what's right, and listening to our bodies. Vitamins can be friends or burdens if we don't understand them. Choose wisely. Choose gently, because your body deserves to be cared for every single day. If today's insights helped you better understand your health after 60, please consider liking and sharing this video. And don't forget to subscribe to join me on a journey of smart, gentle, and loving care for aging well.